Hello, my name is Cameron Savitt, and today we're joined by Dr. Donna Shalala, one of the most influential public servants and university leaders in modern American history. Dr. Shalala served as the longest-serving U.S. Secretary of Health and Human Services, led the University of Miami as president for 14 years, served as president and CEO of the Clinton Foundation, represented Florida in the U.S. House of Representatives, and was awarded the Presidential Medal of Freedom, the nation's highest civilian honor. Across academia, government, philanthropy, Congress, her career is focused on one question: how institutions can improve lives at scale. Thank you very much for joining us today.
Happy to be here.
Absolutely. And what an honor and a privilege it is to have your insights for our wonderful audience of students and early career professionals worldwide. So you've led a cabinet department, a major university, a global foundation, and served in Congress. Which of those roles gave you the clearest understanding of where healthcare actually succeeds or fails and why?
It's interesting. I'm always asked this question. And my favorite job of all times was as a Peace Corps volunteer at the beginning of my career because I learned the most about people's lives there. I was young. I was barely 20. I had just graduated from college. I went off to Iran, uh, to southern Iran, in a Arab uh, village and learned a lot about healthcare and about people's lives and about understanding people's lives if you wanted to make good policy. I wasn't thinking about policy then. I was thinking about basically resilience and ability to get things done in a very different culture.
Wow. And I'm 100% Iranian. My entire family is from Iran. Could you maybe speak more to healthcare in Iran and how that kind of operates compared to the United States or other places?
Hoshalbadid.
Oh, wow. Okay. Yes, yes. That's
Um,
incredible. I mean, are you fluent in Farsi or
no, I'm not
Between
quite
harf
fluent
می‌زنید or-
anymore. I was at one time. I also speak some Arabic because my family is Lebanese.
Wow. Okay. Lebanese Arabic, correct? It's a specific type, right?
Yes, but in Iran, of course, it was a different kind of Arabic
Hmm.
because this was the Arab area of Iran, Khuzestan.
Hmm. Yes.
So
Yeah.
it's a different kind of Arabic. Look, Iranians are very progressive in terms of their healthcare system. For instance, they have the best family planning system in the world. They have a series of clinics all over the country. So they've progressed a lot since the 1960s, since I was there. And I actually taught at a medical college, the University of Gandhi Shapur, in the city of Ahwaz, although I lived in a village and I commuted there once a week to teach the medical students English
Wow. Okay.
because they were studying with German professors who were probably Nazis or escapees from Germany after World War II. And they didn't quite understand the German English, though the institution was taught in English. So I helped to clarify that and to teach the medical students English. It was a very exciting time in my life and very important in my formative years as I took on things like the healthcare system.
Absolutely. And I can't help but imagine that you brought those insights back to the United States. And I'm very curious. A lot of the research that I do with my colleagues is on finding blueprints for, examples of healthcare systems that worked. For instance, like Rwanda after their genocide, how they rebuilt their healthcare infrastructure very famously. Could you maybe if you were redesigning the US healthcare system today from a blank sheet of paper, what's the first thing you would build differently, knowing what you know?
A lot more emphasis on primary care
Hmm.
and health. Um, we did a lot of things in the Clinton administration about eliminating youth smoking, for example. But
Hmm.
if we talked Americans into not smoking, into exercising and eating right, we would have a very different kind of challenges to our healthcare system. But primary care, our system actually emphasizes and incentivizes specialty care
Mm-hmm.
as opposed to primary care. And we need a stronger primary care system, which is what Rwanda did and what much of the world focuses on.
Mm-hmm.
And you obviously need the links to specialty care and to critical care, but without that real strong base, just it's impossible to improve health outcomes.
Mm. And how would you recommend incentivizing people to go into primary care, knowing that, there are these ever-growing concerns of overlapping roles with PAs and NPs and other kind of replace. I was speaking with the department chair of family medicine at Georgetown. She was saying a lot of her colleagues were actually surprisingly laid off from outpatient or care centers in primary because NPs or PAs had been hired. And so what would you say to those concerns?
Well, I wouldn't be concerned about them. I would see them as partners. When we're talking about a modern primary care system, we're talking about integrating nurse practitioners, for example, who could handle about 70% of the primary care challenges in this country. We need well-trained doctors in primary care and family medicine to handle the more complex cases in primary care. So it's got to be a partnership. It's got to be, healthcare has to be seen as a team. And professionals have to not be threatened by nurse practitioners or PAs or pharmacists. They've got to see themselves as members of an integrated team. That's the only way we're going to expand primary care. Family medicine is absolutely critical. The way to get more people attracted to it is really to make it financially attractive. Those incentives, the current incentives, the expense of medical school, for example, push people into specialty care to pay off their loans. And because they can make more money, frankly, in specialty care, and perhaps even have more flexibility if they go into something like anesthesiology or radiology or something like some of those professions. But I think it's important to first see this as an integrated team, and second, to make sure that the financial incentives don't flow towards specialty care, towards procedures, as opposed to taking care of the patient and good outcomes.
Mm-hmm. And, approaching this from the policy perspective, healthcare leadership often rewards technical brilliance, but leadership also rewards judgment and making those calls. How do you know when you're making these kinds of decisions, when to trust data and when to trust instinct?
You don't.
Hmm.
You've got to amass all the data, and AI is going to help this.
Mm-hmm.
And then you make a judgment call based on what information you have and your own experience and the experience of your colleagues. One of the things I emphasize to medical students is don't be afraid to ask the nurses, because often they've had more experience. And if you see them as your partners, then it will make a difference in the kinds of calls that you have to make. But in public policy, I'm a political scientist who has led a cabinet department. I had to make decisions based on the information that was available. Mm-hmm. And so let me give you an example. When we wrote HIPAA, we only focused on the clinical data, because that was what was available to us. Did we know that the internet was going to produce all of this healthcare data? That we were going to have an expansion of things that weren't going to be covered by our HIPAA laws? We had a hint of that, but the only thing we had available to us at the time, and the only orders we had from Congress, was to focus on clinical data. So you do what you can at the time, and you've got to be nimble enough to adjust. But starting with the scientific data, starting with what you know, using every piece of technology to synthesize that information, consulting with colleagues, and then making a judgment call. And some of it is just plain empathy. One of the things I learned in Iran was I learned how to listen to people. And sometimes just talking to the patient will reveal an insight that will help you make that judgment.
Hmm. And judgment is an incredibly important thing, as you mentioned with the development of HIPAA as well. I was wondering if you could maybe speak to that when you helped oversee HIPAA's implementation. What what kind of part of its legacy exceeded your expectations? And if you were designing it today from scratch, would you do anything differently?
Well, we certainly would have included a lot more than clinical information. There's no question about it. I think the important thing with HIPAA was that we started with principles. We didn't just jump in. Now, the only reason that HHS wrote HIPAA was because Congress couldn't do it. Congress actually wrote into the law, if we can't do it, then the Secretary of HHS has to do it. So a year before we left office, one of the Deputy Assistant Secretary for Health walked into my office and said, guess what? We've got to write privacy rules. And I said, you got to be kidding. We've got to do it in a year. The most important thing is that we sat around a table with everybody in the department, everybody that headed an agency, whether they were directly related or not. And after 2 hours, we decided on this principle, that healthcare information should only be used for healthcare purposes. Now, if you start with a principle and then you roll out regulations from that, you can stay focused. Those HIPAA regulations were never seriously challenged once they were published. The Republicans made almost no tweaks, some clarifications, some technical corrections. But to this day, HIPAA fundamentally is what we wrote at the time. And it's because we listened to people, we followed the congressional debate, we talked to the stakeholders, and everybody participated. And we started with a set of principles and kept focused on those principles.
And those principles really kind of move into leadership. And you've spent decades moving between politics and healthcare and even higher education. I'm curious on this topic of leadership, what's one lesson each world misunderstands about the other?
Well, I think we misunderstand how difficult it is and how important it is, not for the leaders to just use their own judgment, but to consider all of the stakeholders and who's going to use the policy and how it's going to affect people. I have always felt strongly that the people around the table had to represent not just race or religion, but economic diversity. So around my table was an agency head, were agency heads that were severely disabled or grew up in poverty. One of my agency heads had rickets as a child. You've probably never seen a case of rickets.
No.
but that means extreme poverty. And so having people, not just hiring people from the best universities that are upper middle class or even wealthy, but having people of very different backgrounds, very different ethnicities and cultural that come to the table and bring their own experience to public policy is the best way to make policy. And, I only had to make decisions when there were disagreements. And then I listened to all the arguments and I made a decision. But in general, we could work out a consensus. Not necessarily that would make everybody happy, but at least that covered most of the people who were going to use the policy or going to be impacted by the policy.
And through all of this, it becomes quite clear that your main philosophy for public service is to have a dedicated kind of moral code behind what you do, or some kind of principle that overrides, all other concerns and helps you stay focused. And, when you evaluate another healthcare leader, what quality matters more in your eyes? Is it intellectual horsepower? Is it emotional steadiness or moral courage? And have you changed your answer over time?
I have. I think brilliance is overrated.
Hmm.
I look for empathy. I look for people that understand people's lives and that listen and have a good feel for how policy will impact on people's lives.
Hmm.
It's not that I look for people. Um, it's just a special trait that makes a good decision maker. I
Hmm.
look for closers, the people that are willing to make decisions, that have some backbone. And once in a while, you make decisions that are really in which you might lose in the end. For example, we decided once we found out that the tobacco industry was targeting children, we decided to take on the tobacco industry. That was not popular with Democrats in the White House, particularly,
Hmm.
because the tobacco industry is very powerful. But we decided on a strategy that focused on children. And that is with a simple fact that if a child did not smoke by the time they were 18, they would never smoke. And so we focused on attacking the tobacco industry on their targeting of children because they had the same data we did, and convincing bipartisan states to impose all sorts of restrictions, local restrictions on where cigarettes could be sold, um, the drug doors, uh, the drugstores. Some of them don't sell tobacco now,
Hmm.
and many of them put tobacco behind glass doors, carding people, making it just very difficult, and convincing young people they shouldn't start smoking. We reduced smoking by 80% among children. That was a
Hmm.
tremendous public health uh, strategy. But we lost the big court case. We started by asserting FDA's authority to regulate tobacco. They took us all the way to the Supreme Court, and the Supreme Court said, you don't have the jurisdiction. They
Hmm.
said, the tobacco industry is bad, but you need to go to Congress. And it took 10 years to get congressional. But meanwhile, we had already won the battle.
Yeah.
Now, that took a certain amount of courage by
Hmm.
both the president and the vice president because they were bucking uh, some people in the White House who worked for the president who had worked for Philip Morris, for example. Philip Morris was the great funder of cultural events in this country,
Hmm.
including cultural events in the African American community and sports events. The tobacco industry was very powerful, but we didn't take them on adults. We didn't take on the issue of whether adults had the right to smoke or the right to drink, for example. We focused on children, and that's where we built bipartisan support
Hmm.
and achieved a great public health success as a result. That's a judgment call. That's a strategy, even though we knew we would lose some of the court cases. I didn't care. What I
You're
wanted to
thinking
do was
long
turn them
term.
into the bad guys.
Yes, absolutely. And that's a fascinating approach of picking your battles. And this comes back to questions of crises in leadership as well. Every great leader eventually inherits a crisis that they didn't create. And this is maybe one of them where the tobacco industry was targeting children. And I'm curious, what's your framework during the first 24 hours after realizing this is way bigger than we expected?
We were well prepared.
Mhm.
Um, my nickname is Boom Boom. which I got during the Carter administration, I believe in attacking issues from every direction. Because if you lose one, you still have other places you can go.
Mm-hmm.
So we knew we were going to lose some things in the process. But by building a national coalition, by convincing the states, Republican or Democratic states, it didn't make any difference whether they were red and blue. We assumed that people cared about their kids.
Mm-hmm.
And once we had convinced the country that the tobacco companies were manipulating to kind of target kids so they had a pool of smokers in the future, we had them.
Yeah.
Now, they've pivoted to vaping, and this administration has been quite weak on that. But it's not that there isn't bipartisan support for protecting children.
Mm-hmm. Yes, yes, absolutely. And a lot of the audience members in this podcast are early career, and they might be looking to your leadership for insights such as this. And you've mentored generations of leaders. I'm curious, in them, what's the most common mistake these exceptionally young, talented people have made in their 20s?
Well, they haven't learned to listen to people, to understand people's lives.
Hmm.
The best way you can practice medicine is by asking questions to the patient.
Mm-hmm.
And sometimes you can't. If you're in an emergency room and the patient is out cold, you've got to make some judgments. But I think that young people starting out are so focused on the data and on information and on what they've learned that they forget that they're dealing with people, with human beings. And AI will not substitute for asking questions and for listening to people. You just have to listen to people. You have to understand their lives to be able to practice good medicine, good healthcare, good education. You just have to have a better feel for multiple cultures. Let me give you another example. One of the first things I did at HHS was I sent out a letter to everybody saying, anyone that has a suggestion for saving lives, come in and see me. So a couple of researchers from NIH came in to see me, and they said, we have this finding about SIDS, sudden infant death syndrome, that if you put babies on their backs, it will reduce SIDS. And I said, what's the science behind that? And they said, well, we're not quite sure of that, but we know this from our clinical studies. So I called the head of NIH and said, hey, have you looked at this? And he said, yeah. He said, the evidence is if you put kids on their backs. So we ran a campaign called Back to Sleep, in which we convinced every hospital in the country, informed a new mother and everyone that delivered a baby, informed a new mother, put the baby on their back. What happened was that when they got home, their mothers said, those doctors don't know what they're talking about, and flipped the baby over. It was particularly true of grandmothers that did that. And so we went to the AARP and said, hey, could you help us with this campaign? We also learned that in multiple cultures, it was tradition to put babies on their stomachs. So we had to run the campaign in different languages.
Wow.
We also, the diaper companies printed on the back of a diaper, this side up. So we went at it from different directions. We also went out and talked to the Hollywood screenwriters, the people that wrote television shows, that whenever they had a baby in the show, not public service ads, whenever they had a baby in the show, could they make sure it was on its back? And could they provide a little bit of explanation that would give a public health message within the context of the show? And of course, all of the baby companies that showed ads, they had their kids on the back. Oh. So it worked. We reduced SIDS. As you well know, We saved probably millions of lives
Hmm.
over the last 20 years. A simple piece of research,
Mhm.
a campaign, not focused on just public service ads. They're very nice, but they don't solve the problem. Going at it from different directions, getting the healthcare system to buy in, but also getting the grandmothers to buy in, getting the different cultures to buy in. Do you see a kid on their stomach very often?
No, no, I don't. I don't.
And you know that you reduce SIDS by putting kids on their backs.
It's incredible. That's incredible. And did doctors know this, or was this not disseminated? How was
No, it
this?
wasn't. It was new information.
Hmm.
And so we had to get it out to everybody.
Hmm.
And we started, of course, with the OBGYNs and with the pediatricians, but it was the hospitals that led because wherever the babies were born, they provided the information.
Hmm. That's simply incredible. And I'm aware that a lot of these OBGYNs as well are heavily involved in, you know, public policy or I mean, I know Alexandria Ocasio-Cortez, for instance, originally wanted to become an OBGYN and eventually pivoted into public service. I'm curious, you know, a- as
Pediatricians, in particular, have been involved in public policy, particularly in relationship to vaccines. They helped us in our great vaccine campaign. And remember,
Hmm.
we achieved immunity in 2000, which now we're threatened with losing all of that in a 5-year campaign that got almost every kid in the country vaccinated in campaigns that were run by the states.
Mhm.
George Bush, when he was governor of Texas, ran a campaign called Shots for Tots. We pushed it down into the states to get them to run the campaigns. We told them to rebrand the campaigns, to take credit for it. And we got most of the kids in the country vaccinated at the right time.
Mhm. And then all of a sudden there's a there's a large counter movement now. And I'm curious if you can speak to how, you know, the current leadership or in within healthcare can kind of approach all of these questions of misinformation and, you know, AI running rampant online and
All we need, all we need is a president and a secretary that says vaccinations will save children from sickness and will save their lives.
hmm,
All we need is for leaders in healthcare and politics to explain to people that this is more than good science. This is about saving our children.
and how would you speak to the current influencer culture? As I'm sure you're aware, there are a lot of questions now about the value of experts in public opinion as opposed to influencers and people with mass online followings who don't necessarily know the science. They're kind of riffing. Is there any way you'd speak to that? You know, speaking
Yeah,
to
I tell them to ask their mothers on why they got vaccinated. I have yet to meet an influencer that isn't vaccinated.
Hmm. Wow. Wow. Okay. Yeah, so
Have you ever met an influencer that's not vaccinated?
I haven't met many influencers, but I am aware that the creator economy is leading to a certain shift in the value of experts in public opinion. And
Yeah,
just
there's no
how can,
question. There's no question about that. But, it's one thing on public opinion. It's another thing to put children at risk, to put
Mhm,
our future at risk. That is just plain irresponsibility,
mhm.
particularly if they themselves are protected.
Yeah, yeah. And do you think it's more a question of ignorance or a question of their malevolent intentions, or how would you approach this? I mean, bringing your philosophy of attacking it from all sides. I mean,
I never question people's motives particularly. All I do is ask them to protect the future, to play some role, particularly when they're young, in protecting the future for others.
mhm.
If their future was protected, then they have a responsibility to pass it on.
Hmm.
But they also have to listen to people in their community who they trust.
Sure, sure.
I
Yes,
have yet to meet an influencer that doesn't take their child to a pediatrician that they trust for their children's health.
yes, absolutely. And, speaking of looking to kind of influence the court of public opinion as an expert, how would you speak to medical students who are listening to this podcast who want to improve healthcare beyond the bedside? If you had one piece of advice to them, what would it be?
I think that they have to learn how to listen to people and how to learn about people's lives. Here's what I tell my students in health policy, some of whom are going on to medical school, that you ought to listen to people and talk to people now. I can tell you the healthcare situation of the person that does my manicures, at the person at the dry cleaners, at the person behind the counter at the pharmacy who's not a pharmacist.
Hmm.
Because I talk to people. I can
Hmm.
tell you every person in my family and every person that I know because I listen to them. The way I learn about public policy is not just from the books and from the data, but I learn from people.
Yes,
And
yes.
that's what medical students have to do. They have to just the person that's sitting next to them on an airplane or on a bus.
Yeah, yeah. To strike up conversations with everyone, regardless
Yep.
of who they are. Everyone always knows something that you don't know. And so that's kind of the approach
There's
that,
always a story.
yes, yes. And a lot of this comes back to becoming a very social person who's just constantly inbound and understanding what the world is like outside of the New England Journal of Medicine or
If you're a medical student and you tell someone you're a medical student, they will pour out their healthcare situation to you. Let me assure you. And that you might think that you're invading their privacy, but you're really not. You're learning.
sure, sure.
And they'll
Uh,
tell you their experience with the healthcare system too, which you can learn from.
just like healthcare kind of goes outside the hospital, the experience of learning about medicine also extends beyond the hospital as well, because healthcare is
Ex-
everywhere
exactly.
that humans are. Yeah, we're actually having uh, an upcoming interview. We're having the CEO of one of the largest post-acute care providers in the country. So it's going to be very exciting to kind of bring this conversation as well there too. Um,
Yeah.
now,
You're at Georgetown?
yes, yes, at
Well, you've
Georgetown
got
School of
have
Medicine.
you talked to Tony Fauci?
I have attempted to, but I haven't been able to get in touch with him. I would love to, but
You should walk down to his lab.
sure, sure.
Yeah.
That would be wonderful.
Tell
I
him I
think
sent you because
really,
you can learn more from Tony Fauci in a conversation because he had to deal with one of the great crises of our time,
mhm.
not just COVID, but AIDS.
Yes, yes, absolutely. And we are having another AIDS. I actually, I so Dr. Fauci is on staff at our medical school. Obviously, he's faculty, and so I've been able to he goes on rounds with us medical students. And so we see him at morning report in the mornings where he comes to our, things and it's really wonderful. Um, but interestingly about COVID and AIDS, we're also having Dr. Abdul Karim, who's the head
Yeah.
of the South African on this podcast very soon. So it's going to be also very interesting to see if we can get Dr. Fauci to
South
bring.
Africa is a tragedy because for years we tried to talk the leadership of South Africa into allowing the United States to give them the drugs to prevent mother to child transmission.
Mhm.
And Mbeki, who was president at the time, was a conspiracy theorist. And
Mhm.
finally, we talked the health minister into taking some of the drugs, but thousands of people died
Mhm.
while we went through this terrible dance with the South African leadership,
Mhm.
trying to convince them that we, at least at the minimum, could affect mother to child transmission.
Mm-hmm.
And it was tragic,
Mm.
but it was conspiracy theories, um, which Mbeki saw on the internet, and people knew better in South Africa, and the South African physicians were devastated.
Mm.
So it was
Awful.
and Tony went through a lot of this.
Mm.
But tell them I sent you.
Okay, I will. I will. No, I appreciate it. And speaking with a lot of these, institutions that might not have the same understanding of a crisis, or people that might not have the same understanding, is really the philosophy that you've built to build institutions that outlast any one individual or policies. And I'm curious, 50 years from now, what do you hope people say about the institutions you helped shape, rather than about Dr. Donna Shalala herself?
Well, I think that what I want them to say is that we started on a road to improve the health of people all over the world.
Hmm.
And we did it strategically. We
Mhm.
built institutions. We doubled the NIH budget, for example.
Mhm.
And we struggled to cover every American with health insurance, but we built an array of public health clinics, federally qualified health centers that made a difference in particularly low-income people's lives.
Hmm. Yeah. And doubling the budget of the NIH is no small feat, especially
Well, it was
when.
the golden age of NIH and of science, in which this administration is unraveling, but it can never unravel completely, because the delicate relationship between the economy and science is so important to the future of this country.
Mhm. Mhm.
But we also focused on children. The one thing that we did over the 8 years is we focused the healthcare system on the future, on our future, which was children, to make sure that your generation was healthy.
Mhm. I think that's an incredibly important take, and something that I would argue is underrepresented in medical school curricula in terms of the preventative approaches. I mean, we learned the USPSTF guidelines, but they mostly apply to, you know, in regards to the USMLE Step 2, they mostly apply to older generations. And so this focus on prevention from the childcare side of things is an incredibly unique and important perspective that you brought to this nation.
Mm-hmm. But we didn't only bring it in healthcare. We brought it in Head Start and childcare. We introduced healthcare to Head Start, for example. They didn't
Wow.
have a healthcare component to Head Start.
Wow.
We expanded federally qualified health centers because one of the things that I recognized when I went and visited them is they told me they had a lot of people who had health insurance that came to them that didn't have a healthcare home. So
Hmm.
we said, you ought to be collecting that insurance money, whether it's from the government or otherwise. So we gave them money to hire finance people to collect the health insurance money, which gave them another stream of income in addition to the government's income. But that was because we went and visited and we asked them what their challenges were.
They spoke directly about it. So, speaking of introducing new topics to institutions as well, there's this ever-growing thought about AI in healthcare. And I'm curious if you could maybe speak to AI in medical training, especially for our audience here of medical students, and uh, how AI is poised to shape medical training, and what are some promises and pitfalls there?
Well, I think that we shouldn't be afraid of it. It's coming. We shouldn't overregulate it right now because we're not quite sure where it's going.
Hmm.
But what's important for medical students is to use it. They will be able to use it in the future to improve health outcomes, but it won't substitute for their judgment.
Hmm.
It will save them perhaps some time because it will synthesize the literature for them. but they still are going to have to make a judgment call. So they should see it as a time saver, as a support system to improve health outcomes of their patients. But like technology, like medical records, they shouldn't be afraid of it, and they should embrace it and learn from it, but know it's going to evolve over time, so they've got to be nimble.
And do you think that every medical student should graduate with formal AI training just as they learn pharmacology or anatomy, or would you?
Yes, absolutely. But whatever formal AI training is today is like economics. Tomorrow it will be out of date.
Certainly.
So you have to learn what you can learn as you do any subject matter, but assume the science is going to change.
Are there any
the technology is
aspects?
going to change?
Yes, and about, rapidly changing tech. I mean, healthcare is a very conservative field. Are there any aspects of AI implementation in healthcare that make you genuinely concerned?
Well, I'm concerned that people are afraid of it and that they think they can control it, and you can't. I'm concerned that they'll over-regulate it and slow it down while the rest of the world is embracing it. So I'm not saying we should jump right in and assume it's going to solve our problems or eliminate our jobs. I am saying we should see it as any new technology that we have to learn from and steer in ways it will help the outcomes of our patients.
And, HIPAA was written for a different era, but it retains those universal points. Is it still the right framework for AI, or does healthcare need an evolved and updated social contract around data?
Well, I think we need we need to reconceptualize all of this. But I don't think Congress is going to do it. And I don't see this administration as doing it. It's too early to figure out how to get our arms around this. But there are certainly some things we can do that have to do with the internet and healthcare information that's coming across the internet. But I don't have a lot of confidence that Congress can do it, because it takes some real thinking, and they don't do that. They can give us some insights by having some hearings with experts, and we can follow those hearings as we did before we did HIPAA, and see whether we can strike a balance. I think we have to be very careful about throwing regulations on something as it's evolving. And CMS is going to put, and worrying about how we're going to pay for it. I'm not sure we should be paying for AI. It's just another technology.
Yeah. Certainly, we're seeing a lot of very affordable Chinese models coming out, obviously, that might, undercut a lot of the high prices that are being.
Yeah, we've got to be very careful. A leader taught me years ago, a former mayor of a big city, taught me that sometimes when you pick up a rock, there's something horrible under it. And young leaders jump right immediately to solve it. But seasoned leaders put the rock down and see if it sorts itself out in a way in which they can actually manage it.
Patience is the name of the game. Yeah.
Patience.
Now, how would you speak to the people characterizing the government as kind of a slow lumbering giant, while there are all these nimble technology advancements that might be harming patient care before anyone has a chance to get to it in a regulatory capacity? How would you suggest that governments stay ahead of the game without overstepping or over-regulating, while still protecting patient safety? It's a delicate balance here.
Yeah, and government has to be strategic about when they enter that. Government can move fast when it wants to. I mean, we wrote the HIPAA regulations in a year, got them through. It took into effect in the next administration, but basically we had cut the deal before we left. We had fought all the good fights, We had figured out what the stakeholders needed.
Hmm.
So government, during AIDS, we hurried up the process at FDA.
Hmm.
Operation Warp Speed is a perfect example of a public-private partnership
Hmm.
that worked.
Yeah.
Now, they had tremendous resources, but they also had very talented leaders. Alex Azar had experience in government as well as in the private sector. He had been president of Eli Lilly, so he understood the culture of drug companies
Hmm.
and he understood the culture of government. So you had the perfect mix in a leader to do Operation Warp Speed.
Hmm.
And he doesn't get enough credit for that.
No, no. And you know, those are incredibly powerful PPPs. I mean, how they're able to accelerate while still maintaining that control. Now, I want to be respectful of your time as well. I wanted to leave you with one last question. For mainly our audience of medical students and early career professionals, do you have any words of wisdom or advice? I know this entire interview has been a wonderful treasure trove of advice, but do you have one final message for our audience?
I think don't don't let those in healthcare that are saying it's a terrible time to study medicine.
Hmm.
Don't let that affect you.
Hmm.
Assume that it's going to be a golden age and you're going to get to embrace new technologies and new ideas. Um, and that's the exciting part. I
Hmm.
want people to see healthcare as an adventure. You
Hmm.
should only be in it if you have in your head that it's going to be a great adventure.
Hmm. Life is
And
a great
listen,
adventure,
life is a
obviously.
great adventure, but medicine is a great adventure, and you ought to be positive and enthusiastic, and forget about all those old people that are saying to you, "The good old days were better."
Hmm.
The future is going to be better.
Good Lord, we've heard a lot of, the golden age of medicine is over, and I'm as well very tired of hearing that. I'm very excited for what's to come. So thank you very much.
Thank you, Cameron. I've got great faith in your generation and in the future.
Thank you so much, and thank you for all that you've done for our nation and for mentorship of the next generation as well. Thank you. So this has been Cutting to the Case, another wonderful episode, and this is Cameron Sabat, and we are signing off. Thank you.